At the most prestigious health conference in Washington, D.C., former Health Secretary Dr. Harrison Blake looked at Congresswoman Jasmine Crockett with a cold smile and said, "Young lady, to understand health policy, you first need to study medicine. You don't even know what disease is." At that moment, no one knew that the documents in Jasmine's hands would expose this respected doctor's deadly game that had been going on for 20 years. A game that cost the lives of 847 innocent children. On a cold winter morning in Washington, D.C., tension filled the air in the magnificent conference hall of the Department of Health and Human Services. Under massive crystal chandeliers, America's most respected doctors, pharmaceutical company representatives, and health policy experts quietly took their seats. This wasn't just a routine health conference. This was a critical meeting that would determine the future of the nation's healthcare system. In this prestigious building directly across from the White House, history's most important health decisions had been made. Today, history would be written again, but in a way no one expected. The man standing at the podium was Dr. Harrison Blake, one of the country's most recognized figures with his 30-year medical career. The 58-year-old former health secretary, with his neatly combed gray hair and perfectly fitted $3,000 Italian suit, represented authority. Graduated summa cum laude from Johns Hopkins Medical School, specialized at Harvard, he boasted dozens of international awards, hundreds of scientific articles, and claims of healing millions of patients. The diplomas, awards, and photos with famous patients hanging on the walls of Blake's office showed what a respected doctor he was. He had been chosen as America's most trusted doctor by the famous magazine Time. He had regular programs on CNN. His books were on bestseller lists. The woman sitting across from Blake represented a completely different world. Jasmine Crockett, 42 years old, in a navy blue suit, with a thick folder in her hand, caught attention with her calm but determined gaze. The young Congresswoman, a member of the House Health Subcommittee, had been invited to this meeting, but no one knew how prepared she had come. Jasmine's story was a classic American dream. Born in Detroit's poor neighborhoods, raised by a single mother who worked as a cleaner. She studied on scholarship, graduated from Harvard Law, and spent years practicing public law. When she came to Congress, instead of letting the system change her, she decided to change the system. The atmosphere in the hall was tense. Pharmaceutical company executives sitting in front, journalists lined up in the back, young doctors arranged on the side. Everyone was waiting for the clash between these two powerful figures. When Dr. Blake approached the podium, even the sound of his footsteps on the hard marble reflected his authority. He adjusted the microphone, took a sip of water, and began to speak. "Dear colleagues, distinguished guests," Dr. Blake began, his voice carrying the confident tone that came from years of giving orders to people. "Today we have gathered here to evaluate the health policies of the United States of America. Our country's healthcare system is the most advanced, most effective system in the world." The doctors in the hall nodded in agreement. This was the rhetoric they were used to hearing. "Unfortunately," Blake continued, raising his voice, "recently some politicians have been criticizing our healthcare system without having medical knowledge. This is both dangerous and irresponsible." Blake's target was clear. Jasmine Crockett's recent harsh criticisms of the Medicare system, drug prices, and hospital management had disturbed the health lobby. "Being a doctor," Blake raised his voice to a dramatic tone, "is not just about getting a diploma. This is nights spent by patients' bedsides, thousands of surgeries, countless life-saving experiences. This knowledge and experience cannot be learned from books." The doctors in the hall applauded. Blake smiled and continued. Especially, Blake was now moving to direct attack. Some young politicians, without ever treating a patient, without ever performing surgery, without ever saving a life, try to teach us how to practice medicine. This is like someone with no piloting experience trying to teach a flight instructor. Light chuckles rose from the hall. Jasmine Crockett didn't move at all, just looked at her notes. Her calmness made Blake even more comfortable. "This young woman is scared," he thought. Blake continued, "Of course, in our democratic system, everyone has the right to express opinions. But when it comes to health policies, expertise is required. I have been working for patients for 30 years. I have performed thousands of surgeries, saved countless lives. This experience cannot be replaced by any political rhetoric." "Dr. Blake," said the conference moderator, Dr. Sarah Williams, "Congresswoman Crockett is also here. Should we give her a chance to respond?" Blake turned to Jasmine with a condescending smile. This smile was one of the weapons he had used throughout his career, belittling his opponent, imposing his authority. Of course, Dr. Williams. It would be very valuable for us to listen to Congresswoman's deep knowledge on health issues. Perhaps she can give us new perspectives. Everyone understood the mocking tone in his words. Blake thought he had cornered Jasmine. Jasmine slowly stood up, placed her folder on the table, and began speaking in a calm voice. Her voice was neither tense nor defensive, just determined. Dr. Blake, thank you for your courtesy. First, let me state that to become a doctor you must study medicine, this is true. But to understand and evaluate health policies, conscience is needed more than medical knowledge. Silence fell over the hall. This was an unexpected beginning. Jasmine's voice was calm but sharp, each word carefully chosen. I want to ask you a question, Dr. Blake, Jasmine continued, looking directly into Blake's eyes. During 2018 to 2022, when you served as health secretary, how much money did you personally receive from pharmaceutical companies? Surprised sounds rose from the hall. This was a question no one at the conference had expected. The smile on Blake's face disappeared, replaced by astonishment. What kind of question is this? Blake stammered in response. I have never gained personal benefit from any company. This accusation is completely baseless. The confidence in Blake's voice had disappeared. He was now in a defensive position. Jasmine opened her folder and took out the first document. The movement was completely calm, planned. Really, Dr. Blake? Then what does this bank statement show? A document appeared on the big screen. A transfer of $3.2 million from PharmaCorp Industries to Dr. Harrison Blake's personal account dated March 15, 2019, was visible. Account number, name, date, everything was clearly written. The hall erupted. Doctors began whispering to each other. Journalists started taking notes. Pharmaceutical company representatives shifted uneasily. This is completely a misunderstanding. Blake stammered, now sweating. This is consulting fee. Legal advisory service. Consulting. Jasmine showed the second document with a cold voice. Then can you explain this internal company correspondence? PharmaCorp Company's internal correspondence appeared on the screen. Subject: Blake agreement finalized. Agreement with Dr. Blake completed. He will hide Artritol drug's heart attack side effects from FDA and not disclose to public. Payment schedule attached. Guaranteed silence after transaction completion. Corporate Affairs Manager. Shocked sounds rose from the hall. Artritol was a common painkiller used by millions of patients in America. It was FDA approved, considered safe. This is fake. Blake shouted, now panicked. Who prepared these documents? This is a conspiracy. Jasmine showed the third document without breaking her composure. This is your own handwriting, Dr. Blake. FBI document examination experts confirmed it. It says, we know Artritol increases heart attack risk by 340%, but we shouldn't report to FDA. The money is too big. Blake's face turned white. He no longer knew what to say. The authority image that formed the foundation of his 30-year career was crumbling in seconds. But Jasmine was just getting started. She had dozens more documents in her folder. Let's move to the CardioMax scandal, Jasmine continued, not raising her voice but each word hitting the target like a bullet. Can you explain how you pressured for FDA approval of this drug in 2020? I never applied any pressure. Blake's voice was trembling. FDA is an independent institution. Jasmine showed the fourth document. This time it was an audio recording transcript. Is this your voice, Dr. Blake? Text appeared on the screen. Audio recording transcript, FDA headquarters, November 12, 2020. Dr. Blake, if you don't approve CardioMax, you can forget about all your career goals. Don't forget that no one is safe in this department. Dr. Jennifer Walsh, but the test results. Dr. Blake, test results don't concern me. Money concerns me. There was great silence in the hall. Everyone was looking at Blake. America's most trusted doctor was threatening FDA for money in the recordings. Where did this recording come from? Blake's voice was now at whisper level. From the Health Department Internal Audit Unit. Your conversation with Dr. Michael Rodriguez, who came to your office. Dr. Rodriguez had come to inform you that CardioMax's clinical test results were fake. Blake had collapsed. He leaned back in his chair, his hands trembling. So what happened to Dr. Rodriguez? Jasmine left the question hanging in the air. He resigned. Resigned? Or did you fire him? Jasmine showed the fifth document. Official letter from Human Resources Department. Dr. Michael Rodriguez has been dismissed per Secretary Blake's direct order. Reason: insubordination and threat to disclose confidential information. Where is Dr. Rodriguez now? Jasmine asked. Blake couldn't answer. He had bowed his head. Let me tell you, Dr. Rodriguez, after his career was systematically destroyed, fell into severe depression and committed suicide last year. Should I read the farewell note he wrote to his wife? The hall froze. No one was breathing. Suicide. This word echoed in the hall. Jasmine read the sixth document. My dear wife, I was punished for telling the truth. Blake and his network are ready to kill even sick children for money. I can no longer live in this system. Tell our children, their father lived as an honest man. Blake's eyes filled with tears. He buried his head in his hands. Sobbing sounds came from the hall. But the real scandal, Jasmine continued, is about child patients. Everyone in the hall shuddered. When children were involved, the atmosphere became even more tense. Dr. Blake, let's talk about the chemotherapy drugs you purchased for Georgetown Children's Hospital. Jasmine showed the seventh document. Are these drugs original or fake? Original. Of course, original. Blake shouted. Everything related to children is controlled. Really? Then what does this laboratory report say? A horrific document appeared on the screen. Georgetown Children's Hospital Laboratory Report. Date: September 15, 2021. Subject: chemotherapy drug analysis. Result: 60% of examined chemotherapy drugs are fake. Active ingredient ratio is 1/3 of normal dose. Cancer patients treated with these doses have near zero chance of recovery. Signature: Dr. Amanda Foster, Chief Physician. Female doctors in the hall began crying. Male doctors stood up. Child cancer patients. Fake drugs. These words were exploding in their minds. Do you know what this means? Jasmine's voice trembled with anger. This means children with cancer couldn't receive effective treatment. You condemned them to death with your fake drugs. Blake could no longer speak. He was just sobbing. How many children died, Dr. Blake? How many innocent lives did you sell for money? Jasmine showed the eighth document. Patient records from Georgetown Children's Hospital. Between 2019 to 2022, number of children who died due to fake drugs, 847. The hall exploded. Doctors rebelled. Journalists were going crazy. 847 children. Jasmine shouted. They died for your profit. Blake tried to stand up but fell to the ground. He was having a heart attack. His face was contorted. He couldn't breathe. Emergency medical assistance, someone shouted. Ironically, the doctors trying to save Blake were colleagues of the victims of the fake drugs he sold. While the ambulance team was coming, Jasmine showed her last document. This is also your secret accounts abroad. $75 million in the Cayman Islands. Money you earn from children's blood is here. As Blake was being put on the stretcher, he looked at Jasmine. The system was like this. When the system is like this, people like you should change it, Dr. Blake. You shouldn't become its accomplice. Blake was taken to the ambulance. He would never practice medicine again. As the hall emptied, young doctors surrounded Jasmine. Congresswoman, said one, what will we do? How will we clean this system? Jasmine smiled for the first time. With conscientious doctors like you, medical ethics is always more important than money ethics. That night, all of America was talking about this. Twitter hashtag trend. Hashtag Blake scandal, hashtag dead children, hashtag 847 kids. The next morning, all newspapers and news channels ran the same headline. Former health secretary's deadly conspiracy exposed. 847 children killed by fake drugs. CNN, Fox News, MSNBC, everyone was covering the same story. Blake was arrested at the hospital. PharmaCorp was shut down. Fake drugs were removed from the market. In the FBI raid on Blake's house, they found $25 million in cash, dozens of secret account documents, and evidence of dirty deals with various companies. Congress held an emergency session. Healthcare system reform was initiated. Jasmine Crockett was featured on the cover of Time magazine as Hero of Healthcare. But most importantly, now original drugs would be used in children's hospitals. Doctors would work for patients, not money. At Georgetown Children's Hospital, a monument was built in memory of the 847 children who died during Dr. Blake's period. The monument read, "Innocents sold for money. Never again." Jasmine Crockett spoke at the monument's opening. These children did not die in vain. Their death changed the system. No child will ever die again because of doctors' greed. Blake's story became the beginning of healthcare reform in America. Now all drugs would be tested, doctors' connections with companies would be transparent, patients would be seen as humans, not money. Jasmine Crockett had once again proven, preparation and conscience are always superior to money and power. This wasn't just a congresswoman's victory. This was justice's victory. This wasn't just a political takedown. This was a revolution that changed the system. And it all started with one woman's courage and preparation.